Well, I'll tell you my story. Interviewing for a job. And they said, well, so-and-so, you are reporting to him now, right? I said, yes. So he then, for you to get this job, then he would be reporting to you now. How's that going to work? I said, what do you mean, how's that going to go? Well, he's going to leave. Why would he report to you? And I was so appalled by this question that I had to come back with I said, okay, I'm definitely not going to get this job. And by the way, I don't want this job because you're in that search committee and you're working there. And I don't want this job. So I'm going to tell you the answer. So my answer was, I would make sure that you never have to ask that question again from anyone else. That anyone who's, any institution that is beholden to one person leaving is, so I turned it around as his weakness, not mine. Of course he would report to me because you'd make sure the leadership would be supporting the new leader. But only because I'm a woman, and how is that going to look that this man is going? And several times, every time I've been up for a promotion, every single time they would say, well, these people aren't going to report to you. Why should they? And in what way should they not? In what way should they not? I've been a very effective, very, very successful leader for everything that I have developed. And so that's why there's so much gravel in our shoes.
I hear all the time, and I've had the experience, if you are selected for a position over a man, that there is...
it would be absolutely horrific for you to be able to then lead, especially if it's in the same institution, because you always know that you are being, evaluated, and everyone would be coming after you. And in so many ways, I was actually happy that I didn't get this. Yeah. And it's, so what has it done to me? It's made me rethink whether or not I even want those leadership positions because they're just not ready for me. But what am I doing? By that kind of thinking, I'm feeding the beast. I'm saying, oh yeah, just have men. Just choose men. Because you know what? Women aren't going to need to take this. I don't need to take this. I don't want this.
Mm-hmm.
Difficult. Very difficult. Hard conversation.
And again, coming back to this subconscious bias, this empathy, for somebody who missed out on the job, that is not there if the woman misses out.
Right, exactly. Yeah, and that happens all the time. There's really great data on all of this. And what's very, what's incredible now is that the boards, the C-suites are looking for more and more women, but the women don't want to go in there.
Yes.
Because they don't believe that they will be listened to. They don't believe that. Why do you want to go into a C-suite? You want to be effective. Women actually want to be there not for the title, but for the work that they want to do to make change. I mean, why would I want those positions that have so much responsibility? For me was to be the bright change of the future, to let them see things with different colored glasses. See the world in a colorful way. The world is colorful. We are not a bland, all-male... Yeah, exactly. And so I'm exhausted. I'm tired.
Absolutely. I think the commitment to the cause is equaled by the fatigue that you carry with the cause.
Yeah.
But I wanted to ask you, Roxana, and you've been so generous with your time.
Of course.
We've had some events here specifically targeted for women. We've had apéros. We had an apéro for women in surgical research. So we haven't even...
No, you don't want to go there in the surgical thing. And we didn't touch the mental health issues either and suicides and things like this that are going on in women. more so than in men.
Absolutely. But I did have, we sent out a flyer for an event, and a woman wrote back and said, why aren't men invited to these events? So obviously we have to educate men. But what is your opinion about the role of women?
Yeah, I mean, I see her
it's not our only event.
Yeah. So here's what I think. We need both of those events. Women need to be able to talk to each other and unwind and be able to say things with their filters off. But they also need to be in networks of men, because that's where all the power is. And if in order to climb, you need to network with men. And I have found that I hope there are men listening to this conversation, because when they do listen, men are not evil. They're great. They're great people. They're horrified. They're horrified that they could have been part of that fabric of misogyny, that they could have been part of that fabric of poor treatment to women and the lack of women promotion of women, or that they saw women as the lesser of the two genders or sexes. And in my mind, I think it's good for them to hear our stories, because it gives them sort of a, like, literally, what's going on here? Like, really? Is this real? And then it gives them the flashbacks of the times that they might have participated in some of those biased issues. And when they talk about, if we do this without them in the audience, and they start to see a promotion of large numbers of women, they might very well say, we are the canceled culture now, and meritocracy has gone away, and the bar is so much lower, and that's why all the women are getting in. And we need to step away from that kind of conversation, and we need to say, you know what, many of you guys also are going to be asked by the very strong next generation women to stay home and take care of the children. And I believe that the family leave policies have to be, in fact, not give a woman, no woman wants 3 years off for maternity leave. And many of the European countries said, look, we saved that job for her to come back 3 years. Who wants to come back and be right back at the lowest level of the totem pole and not be? Nobody wants to take that much time off. But if they do, great, let them. But what I suggest, and we have to, so much needs to be done, but family leave policies should probably be done in series, not in parallel, for the couple.
Yeah.
So, myself and my partner have decided to, I'm taking 6 months and he's taking 9 months. I'm going to take the first 6 months. He's going to take the next 9 months. He's on paternity leave. I'm on maternity leave. Together, it makes 1.5 years of our child having a parent at home. What's wrong with that?
It's not rocket science.
Why isn't that already working?
Why is it so hard?
And I believe that that our society, structural changes in our societal thinking has to be, and it's already happening. I can tell you that many men realize that when they didn't have their fathers around, they're realizing they want to be there for their children. And their spouse or their partner is demanding that you have to be there. And now with so much gender fluidity, it really doesn't matter what your sex is and who is the responsible person. Someone takes the responsibility, or it is shared, or it is divided. And it needs to be then viewed in that way.
So I want to ask you, I have a number of people I mentor, and one of them said to me, I've got a question to ask, and I thought it would be about, which journals to submit to, or which, and said, should I have children?
Yeah.
And I thought
they always ask me that.
I thought that was really extraordinary, because it's not about whether they want to have children, it's about how can they do both.
Mm-hmm, mm-hmm.
So I've got 3 children.
I've got 3.
And none of them are in medicine. They all looked and said, your road was way too hard. And I think that might be a generational shift as well, whether people do want to fight as hard. But I'm really concerned about women who aren't having children, not by choice, but by this pressure, because they want to get up to be like you, but they don't think they can do it with children.
Yeah, and and for me, it was also a late marriage and late children. I mean, and later in life, a little bit later than most of my same age friends. And I always felt like I was missing out. And I recall my mom who always said to me that, oh, you could do it. God gave you these legs to stand on your own legs and your own feet and not on anyone's shoulders. And I never want you to have to ask for money from anyone. You could do it and all of that. And so when I was 32 and I showed up with my beautiful paper of the patterns of in-stent restenosis on top of in the front page of Circulation, and I showed her the thing, she said, oh, please, no more papers. No more papers. When are you going to focus on your spouse, your partner, your life? What about you? What about the balance of life for you?
Mm-hmm.
And it was then that it gave me the realization that, you know what, if I choose the right partner, I can do that. Anything is possible. I'm telling you, I am the quintessential impossible situation that, and it could happen. And I'm not saying that you are that far away from it. Don't think, oh my God, that not everyone is going to get that kind of, the satisfaction comes in the fact that you will get promoted, you will be a professor, you will, if that's your goal, or that you'll be a great cardiologist taking care of lots of patients, or you'll be a clinical trial leader. You could do it all, whatever it is, or you could be a chef. I don't know. Whatever you want, it can happen. And that the idea is that you should not give up and you should continue to move towards your passion, your goals, and everything else. Now, do I regret some of that? Yeah, I do. I
Regret?
I lost. I think my children lost, obviously. I think thank God they're okay, but I don't know what would be the difference if I was always there for them. But I think I missed out a lot. And maybe if life was not, if the environment was more friendly, that I would have had a more fuller life as a parent. And that I wouldn't have to think or cry in the shower or be depressed about the fact that I don't remember some of the most fundamental, important parts of my children's lives because I wasn't really there as much as I should have been, or I would have been, or I wanted to be.
But they wouldn't have it any other way.
My children are they think they're amazing. 2 of them want to be physicians. I don't know why, but they do. But I feel like you miss out. That's why the environment has to get better so that women feel fulfilled both on a career level as well as their family level.
Okay, so now I have to come to the person who, in the words of the great RBG, the special place in hell for the woman who is worse than...
That's Madeleine Albright who said...
Madeleine
Albright. There's a place in hell for any woman who doesn't lift another woman. Now, you know that I'm the founder of Women as One,
yes,
which is a not-for-profit organization whose only mission, and you only have one thing they want to do, is promote talented women to the right opportunities. Because, and you remember, we really worked on the mission statement very, very, very carefully. It's the hardest thing you do when you have an organization. You come up with a mission statement because you have to drive with every one of those words. And it really is about promoting talented women to opportunities that they want, their opportunities. So it is really a very important thing. And when we put that up and we started with some of the programs that we have an escalator award program, we wanted to make it easier for you to get time, for research. Like you want to do research, you get funding for protected time. All those things that are just so difficult and so competitive, and when you're competing against men, you're never going to get those opportunities. And so we offered these opportunities to some women who have like completely grown, and we say, and this is my motto, once you climb through our climb program, you must lift. Climbing comes with the responsibility of lifting. And if all of us did that with all of our hearts, climb and lift. And it's hard to do because you work so hard to get to that pinnacle, and now you make it easier for someone else to jump many levels ahead. It's like ladders and snakes, you know, you go up the ladder very much faster, and you could be bitten by the snake. But certainly, it's harder for women to then promote it. But I would say there's a place in hell, Madeline, thank you for that, for any woman who doesn't promote or protect another woman. This really has to be something we do. Because men do it all the time. It's like they do it in the locker room. They have a different way. They promote each other. They set up networks. They're on golf courses. They're going to football games, and they're figuring it out. They don't have that catty, like, oh, if I bring her, then I'm not going to get promoted. They might choose her over me, and I worked so hard and I got. You cannot think that way. That is thinking small and narrow, and that is hurting the next generation of women. And maybe you won't be chosen because now you've aged at a level that you're not. But aren't you going to feel better that you gave an opportunity to another woman to succeed? And hopefully, if she's climbing, then she will lift you. It can go either way. I really believe that. And that's yet another thing that my mother taught me, is that always treat everyone, your subordinates, everyone, as if there may be your boss someday. That janitor who comes in, who's changing your garbage pail every day at 3:00 in the afternoon, this man comes in there. I stand up from my seat. I thank him, and I say, thank you for your service. And I often bring him food, and I make sure that he's taken care of, and I respect him, which is what he needs to be respected. Everyone needs to be respected. Just because you are up there doesn't mean that you're so glorified that you no longer can be respectful to subordinates and to those who have not had the opportunities that you have had. And those are the kinds of things that I live by. And I sleep very easily with those things all the time. Feel good about it all the time.
Look, the problem is the diversity of human nature and behaviour, and also how we've been selecting medical students in such a competitive environment, and then we turn around and expect them to be the best collaborators. You know, it is tricky, isn't it? Coming back to that diversity, though, how are we going to overcome that issue? It's very interesting coming from Australia to Switzerland, because they come from a highly multicultural society. Coming here, and I think I hear a lot that Swiss people want diversity.
And I think, why wouldn't they? Well, everybody would want it, I think. I hope. Look, it's always hard to change what you've been used to. But these next generation, I think the next generation, the next couple of generations are just a lot better than us.
I think they're going to have it a lot tougher than us, actually, in some ways.
Yeah, no, I think so too. Yes, I agree. But we have to be bright and happy and make sure that we leave a very good, positive view of the future.
So you did mention many times the mental health of women, and let's address that. I mean, the data is clear. What can we do about that?
Yeah, the stigma of mental health issues are tremendous everywhere. We know that once you talk about what your mental health issues are, especially as a physician, you may then be questioned, are you fit to take care of patients? Are you fit to, and is there substance abuse there, or is there other issues that precludes us? Because we are physicians, we take the Hippocratic Oath, and we're all there to care for patients, and we have a huge responsibility. But mental health is a real illness, so we have to be able to really, and it's treatable. It's treatable.
But how is this a gender issue for medicine?
I think because for based on the fact that all of the things that we discussed, all the difficult, who doesn't have mental issues? How could you not? How could you not be feeling desperate and depressed and stressed and underappreciated, underrecognized, under-promoted, just under everything? You feel like you're under a rock half the time, and no one sees you. And when they see you as the nurse, the janitor, the assistant. We talked about that. And here you are with the highest level of education, but still people see you less than. So of course that is one of the reasons. And it's so much more disproportionately on women. And the COVID pandemic is a huge, strong reminder how women were stressed, because not only did they have to take care of their jobs, they had to take care of, now the children came home, then they had to take care of the house care, and they didn't have any more help. Nobody came to work. Everything was on women. And many lost their jobs, many, because they couldn't handle it. And many ended up with huge mental health issues. It's a crisis in our country.
And we should also touch on the health of women. We started talking about trials where, from the laboratory through to the clinical trials, traditionally the model's been the male rat. Female rats are too hard to handle.
Well, they have to produce more people. Like, so female pigs produce more pigs.
Yes,
because they have the, so it's a reproductive factory too. Remember that. And that's another reason why a lot of these animal studies are also done in it's crazy. It's crazy. We don't even, the preclinical scientific lab data are mostly on male animals. So we just have very little evidence on women. And in our Lancet Commission, we underlined the importance of really rebooting the system and rethinking this, that by 2030, we have to reduce the global burden of cardiovascular disease in women. We have to figure this out, and we have to do this in a very, very open way. We can't look at it as a cookie cutter, one size fits all. Women are not small men. We are different biologically, hormonally, and in every step of the way, we have to do work to make sure in our clinical studies that we have diversity of gender and sex in our clinical trials. Otherwise, whatever we find may not be implementable because it doesn't fit the population of patients that we are treating.
And you are the chair of the Lancet Commission. I mean, I haven't listed all of your achievements because that would take the whole interview, but we certainly will have them, but we were taught that chest pain is central and goes down your arm and gets worse, when you walk.
Yeah, and something, and the other part of it is that we're also seeing for years and years these atypical syndromes or that women would come to the cath lab and they would find non-obstructive coronary disease, and they would say, well, it's all in your head. Oh, it's anxiety. Go and rest, or things like this. And stress and anxiety actually does promote atherosclerosis now, we're learning, and it's exorbitantly higher in women. But we're now learning of this entire entity of non-obstructive coronary disease that's much, much more prevalent in women, with ischemia and myocardial infarction, Minoka, Inoka, as well as spontaneous coronary artery dissection, and other entities like Takotsubo, where the heart blows out and you basically have normal arteries. The truth is that until now, that had never been recognized. And now that we have high sensitivity troponin biomarkers that will show myocardial injury, that yes, something is happening to these women that don't have anything. It's not all in their heads. We're exploring and finding that it could be microvascular disease, vasospastic angina, and other things that has been previously sort of never studied, and we have no data. So now the time is for us to perhaps design studies for women, maybe just women, because we just don't know the answers. And or be smart enough to say, if we're doing an all-comers study, let's cap the enrollment once they reach the strata of the kinds of patients that they're treating in their encatchment area. So if their encatchment area is 40% white men, and 30% African Americans, okay, you finish your white male. Now the African American patients get enrolled. So this is the kinds of things we have to really be thinking about if we are going to be intentional to get some data on women.
So there's a whole new textbook out there.
Yes.
And the best people to lead it are women.
Yes. And there aren't enough women.
And there aren't enough women.
And they're leaving by the droves. They are not getting it. This is
They're
window
still
dressing.
getting paid less.
Yes, still getting paid less, asked to be doing more. And I'm afraid that even all of the things that we're working on are still not going to make the impact that we're looking for because of the fact that the societal place for women have not been changed structurally. And until we start to see them in a different light, we are just not going to get there. Look, we're in a better place now. Many men and women are used to now seeing female physicians.
Yes.
But how many times if I walk with my medical student in there, they will go to my medical student saying, "Doctor,"
Professor,
and say to me as the nurse,
"Yes,
are you the nurse? Are you the assistant?" I'm so used to it.
Yes.
And we have to keep educating. There are lots of women professors here, and I am the professor. I'm the boss of this team. I decide your destiny here. I'm deciding it, and I'm going to do a great job, and I'm going to take great care of you.
Roxana, you must be exhausted. You flew in today.
I think this has been a great
incredibly generous with your time and your advice. I think people listening to this will be totally inspired.
Well, thank you. And I just hope for all of you who are listening, first of all, I'm really sorry that I'm not there. Really had to get back. But most importantly, listen to your heart. Follow your heart. Work hard. There is no free lunch. You still have to work hard. The world will get better. Otherwise, we will all implode. So drive at your goals and do not give up, because you will be really, really satisfied when you get there, and that you will make this world a better place for the next generation of women. You could be the example of how it is all very possible. And you could be the change that we're all looking for and been frustrated by. So keep going.
And I would just add, use other women to support you, because it's something we need to do together.
We all need to network. And yes, and we need men, the good men in the room.
And there's plenty of the good men.
There's plenty of them. I often say, well, there are a few good men in this room. They made a movie, A Few Good Men. I just sort of make a joke, but the truth is there are many, many great men out there. Most of my mentors were men, and I am forever indebted to them.
Thank you, Roxana. I hope we have the chance to meet with you again or talk with you again.
Thank you so much.
And very, very best wishes for all your incredible endeavors.
Thank you so much. It's been an honor to be here. Thank you.